asking, whatever question I
Yes,
have
sir.
asked, have I given you in medical portion what I give just now? No, it was not given. These are new questions.
Oh.
So there are abundant of questions, right? It's an ocean of questions we have. You should prepare all.
Yes.
How are you feeling with PD classes? कैसा लग रहा है?
I'm feeling very fine, sir.
Okay.
I feel more confident
Okay.
now.
It is our duty also, yeah, to make you confident. Tell about asthma management.
Asthma management, there are two ways we can manage asthma. If a patient presents with asthmatic attack or he have chronic asthma. If patient presents with acute asthmatic attack, we have to proceed different way. Both the situation, we have to proceed with the bronchodilators, beta 2 agonist. We have to give steroids either orally, either in puff or IV. We have to give oxygen supply, moist oxygen supply, and then we have to give some antibiotic to prevent the basically hospital acquired infections. In chronic condition, if patient presents with chronic asthma, we have to first rule out the degree of bronchoconstriction in the patient, or we have to check the lung compliance. After that, we proceed with a short, depending on the patient, we give a short-term bronchodilator, long-term bronchodilator with prednisolone or other steroids, and some mast cell stabilizer, montelukast or jafirlukast. Or in worst case, we have to give monoclonal antibodies.
Wonderful. Now tell about cirrhosis.
Cirrhosis is basically inflammation and fibrosis of the liver. It occurs either in alcoholics or non-alcoholics, or it can also occur in after viral infections or bacterial infections, in which the liver get inflamed, and after that, in due course of time, the liver get fibrosed. The hepatic architectures get distorted in cirrhosis.
Okay, my next question is diabetes insipidus.
Diabetes insipidus is a type of diabetes. It can be the patient diabetes insipidus. It can be of two types: either central diabetes insipidus or nephrogenic diabetes insipidus. It is basically due to the either ADH, decreased level of ADH, or the receptor responding to ADH get defected. In central diabetes insipidus, there is decrease or no levels of ADH. And in nephrogenic diabetes insipidus, there is ADH is abundance in the blood, but the receptors responding to the ADH is hampered, basically, leading to the increased osmolarity of blood and decreased osmolarity of the urine and polyuria and polyphagia.
Okay, tell me about portal hypertension.
Portal hypertension. Sir, I will recall, sir. I cannot recall.
Okay. Now my next question is cardiac tamponade.
Cardiac tamponade is basically due to either trauma or a sudden rupture of any superficial blood vessels of the heart, leading to accumulation of fluid in significant amount, causing heart to perform its function. Performance of the heart get decreased. There are three main features of cardiac tamponade, that is raised JVP, muffled heart sound, and decreased systolic heart blood pressure. That is also known as Beck's triad.
Okay, tell me about ascites. Ascites.
Ascites, there is accumulation. Ascites is basically the accumulation of fluid in peritoneal cavity. It can be it can be due to many reasons, like liver or kidney involvement, or it can be due to congestive heart failure. It can be due to portal hypertension, cirrhosis. Basically, the oncotic pressure of the blood get decreased and fluids seeps out of the vessels and get collected in the peritoneal cavity. And depending upon the fluid, there are two types of fluid. That it can be either transudative fluid or exudative fluid. And we divide this transudative exudative on the basis of protein content in the fluid.
Very good, doctor. Excellent. Tell about acute kidney injury.
Acute kidney injury. Sir, acute kidney injury occurs either due to toxins or any drugs or any poisoning conditions, or in cancer category patients, when we give patients chemotherapy, there is a chances of occurrence of acute kidney injury. There is inflammation of the renal parenchyma, renal tubules, leading to failure of the functionality of the kidney. Mic is off, sir. Your mic is off, sir.
Vasculitis.
Vasculitis is basically the inflammation of small and medium-sized blood vessels.
Vital blood supply. Cutting off vital blood supply to tissue and organs.
Yes, sir.
So, would you like to tell something about can cause vessel walls to thicken and narrow, cutting off vital blood cells to tissues and organs?
Vasculitis is basically inflammation of the tunica media of the small and medium-sized blood vessels supplying to the particular areas. Okay. Which further vasculitis can be fibrinoid or calcified or lipoic. There are different types of vasculitis that occurs in the blood vessels.
Okay.
Fibrinoid, there is saponification of the fat, cholesterol with calcium, or there is calcific vasculitis, that is deposition of the calcium in blood vessels, tunica media, which leading to hardening of the blood vessels. Sorry.
Okay, you already stated very well. Do you know about AED?
AED, sorry, sir. Would you like to tell me the full form, sir?
Yeah, I'll tell. Sure, yeah. Automated external defibrillation used to give DC shocks.
Sorry, sir.
Right?
Yes, sir.
Okay.
I don't recall, sir.
Wonderful, yeah. You have answered very well. I appreciate. Can you tell me about ACLS?
Yes, sir. Advanced cardiac life support. This is basically it is used in basically trauma management in patients. The WHO gives the guidelines to manage the trauma patients.